Have you ever taken off your socks at night and seen deep rings carved into your ankles? Not a little mark, a deep dent that stays there. If your feet feel tight, heavy, shiny, or too swollen to fit comfortably into your shoes by morning, your body may be trying to tell you something important. I'm Dr. Claire Bennett, and today I want to walk you through 7 gentle bedtime steps that can help many seniors understand foot and ankle swelling more clearly, reduce evening fluid buildup safely, and know exactly when swelling should not be ignored. Because swollen feet are not always an emergency, but they are never something to dismiss without paying attention. Let's begin with something very simple. When your feet or ankles swell at the end of the day, what you are usually seeing is fluid collecting in the tissues. Doctors call this edema. Sometimes it happens after standing too long, sitting too long, eating a very salty meal, traveling, or spending a hot day outdoors. But in older adults, swelling can also happen because the veins in the legs are no longer moving blood upward as strongly as they used to. Think of your leg veins like a one-way road back to the heart. Blood has to travel upward from your feet against gravity. To do that, your veins rely on small valves and on your calf muscles. Every time you walk, flex your ankles, or rise onto your toes, your calf muscles squeeze the veins and help push blood upward. That is why the calf muscles are sometimes called the second heart. But when you sit for hours, stand still for hours, or sleep with your legs in a poor position, that natural pump slows down. Fluid can collect around the ankles. The skin can feel tight. Your socks may leave deep marks. Your shoes may feel smaller by evening. And sometimes, when you press a finger into the swollen area, the dent stays there for several seconds. That is called pitting. Now, before I give you the bedtime routine, I need to make one safety point very clear. New swelling in one leg only, especially if it comes with pain, redness, warmth, sudden shortness of breath, chest pain, faintness, or coughing blood, is not a home remedy situation that needs urgent medical care. Also, if swelling is getting worse quickly, appears after a fall or injury, or comes with severe breathlessness, please do not wait overnight to see what happens. For everyone else, especially if you have the familiar pattern of both feet swelling toward evening and feeling a bit better after rest, these 7 bedtime steps can be a practical place to begin. Not as a cure, not as a replacement for your doctor, but as a safer, calmer, more intelligent way to help your legs recover at night. The first bedtime fix is not something you do with your feet, it is something you notice with your eyes. Before you start any routine, take 30 seconds and look at both legs. Compare the right and the left. Are they equally swollen? Is one calf suddenly bigger than the other? Is there redness? Is the skin hot to touch? Is there a new sore, blister, weeping fluid, or broken skin? Do you see a sharp line where your sock has cut into the ankle? This small inspection matters because swelling is not one single problem. Sometimes it is simple fluid pooling. Sometimes it is a vein problem. Sometimes it is related to the heart, kidneys, liver, thyroid, medications, or lymph drainage. And sometimes it is a blood clot. Many seniors skip this step because they are used to swollen ankles. They say, "Oh, my feet always look like that at night." But your body changes over time. A pattern that has been stable for months is different from swelling that suddenly appears this week. So tonight, before you do anything else, look. Then press gently with one finger over the shin or ankle for about 5 seconds. When you lift your finger, does the dent remain? If it does, just remember that information. You do not need to panic. You are simply becoming a better observer of your own body. And here is the simple rule I give my older patients. If the swelling is new, one-sided, painful, red, hot, or linked with shortness of breath, that is a medical call. If it is mild on both sides and mostly worse after a day of sitting or standing, then we can talk about safe support. That brings us to bedtime fix number 2. Use your calf pump before you elevate your legs. Most people hear raise your legs and they immediately put their feet on a pillow. That can help, but it works better when you first turn on the muscle pump. Remember, fluid does not move well through still legs. Your calf muscles need to squeeze. So before you lie down, sit on the edge of your bed or in a firm chair. Place both feet flat on the floor. Now slowly raise both heels as if you are coming up onto your toes. Hold for 2 seconds, then lower the heels. Do this 10 times. Next, keep your heels on the floor and lift your toes toward your knees. Hold for 2 seconds, then release. Do this 10 times. Then make slow ankle circles. 5 circles one way, 5 circles the other way. This takes about 2 minutes, but it wakes up the muscles that help push blood and fluid out of the lower legs. Let me give you a real-life example. A 72-year-old woman once told me, "Dr. Bennett, I elevate my legs every night, but they still feel like sandbags." When we looked more closely, she was going straight from sitting on the sofa for 3 hours to lying in bed with her legs propped up. Her calf pump had been asleep all evening. Once she added 2 minutes of ankle pumping before elevation, she noticed that her legs felt less tight. Not cured, but lighter. And that is the goal of this routine. Small, repeatable improvements that make daily life easier. Now we move to bedtime, fix number 3. Elevate your legs, but do it correctly. This is where many people make a mistake. They put one small pillow under the ankles, bend the knees sharply, and stay in a position that is not very helpful. For swelling, the goal is to help fluid move from the feet and ankles back toward the center of the body. So the lower legs need to be comfortably above the level of the heart when possible. You can do this in 2 ways. The first way is lying on your back with your legs resting on 2 or 3 pillows, so the calves are supported, not just the heels. The second way is the wall position. Lie near a wall and rest your legs upward against it. You do not need to force your hips right against the wall. This is not a yoga competition. You are looking for comfort. If your hamstrings feel tight, move farther away from the wall. If your back feels strained, bend your knees slightly. Stay there for 5 to 10 minutes. During that time, repeat a very gentle ankle flex. Point your toes away. Then pull your toes back toward your knees. Do this slowly, 10 times. Rest. Then repeat once more. This combines gravity with movement. That is much better than lying still and hoping the fluid moves on its own. But please listen carefully. If lying flat makes you short of breath, do not use this position. If you have severe heart failure, uncontrolled blood pressure, recent surgery, or a doctor has told you not to elevate your legs in this way, follow your medical advice first. This routine is for everyday evening swelling, not for unstable medical conditions. Now, bedtime fix number 4 is where I want to change something from the usual internet advice. You may have heard people recommend extreme hot and cold foot baths, very hot water, very icy water, a shock to the veins. That sounds dramatic, and it may get attention in a video. But for many older adults, especially people with diabetes, neuropathy, fragile skin, poor circulation, Raynaud's, or balance problems, extreme temperatures can be risky. You may not feel heat or cold accurately. You can burn your skin, you can irritate blood vessels, you can even make discomfort worse. So I prefer a calmer version. Use a warm foot rinse, not a shock bath. Fill a basin with comfortably warm water, not hot. Test it with your elbow or with a thermometer if your feet have reduced sensation. Soak for 5 minutes, then dry carefully, especially between the toes. After that, use a gentle, unscented moisturizer and massage upward. Start at the toes, move over the top of the foot, circle around the ankle, then use both hands to stroke upward along the calf. Always move toward the heart. Use firm but comfortable pressure, not deep, painful pressure, not digging, not bruising. And avoid massaging directly over a painful, red, hot, swollen area. That could be dangerous if a clot or infection is present. The point of this step is not magic oil. It is touch, direction, and consistency. The upward massage reminds the tissues where fluid should go. It also gives you another chance to notice skin changes, dry cracks, blisters, open sores, fungal irritation between the toes, areas that look shiny or fragile. For seniors, foot skin is not a small detail. A tiny sore can become a larger problem if circulation or blood sugar is poor. So this gentle massage is both a comfort step and a daily inspection step. Now we come to bedtime, fix number 5. Protect your legs from the evening habits that refill them. This is the step many people miss. They do the foot soak, they elevate the legs, then they sit back down and cross their legs for an hour, or they sit in a recliner with the knees bent sharply, or they watch television with the feet hanging down. Then they wonder why the swelling comes back. Think of your veins like soft garden hoses. If you bend the hose, water does not flow well. When you cross your legs, tuck one foot under your body, sit with the edge of the chair pressing behind your knees, or sleep with one leg folded tightly over the other. You can slow the return of blood and fluid. So tonight, after your leg routine, keep the path open. Sit with both feet supported. Do not let your feet dangle. Do not cross your legs. If you sleep on your side, Place a pillow between your knees and ankles. This keeps the hips, knees, and ankles more aligned. It also reduces pressure where one leg rests on the other. And check your socks. This is very important. If your socks leave a deep red groove around the ankle, they may be too tight. Many seniors wear socks that were comfortable 10 years ago, but their ankles have changed. The elastic band becomes a little tourniquet. It traps fluid below the line. Choose socks with a soft, non-binding top. Your socks should stay up without cutting in. This one change can make a surprising difference. Now let's talk about compression, because this is where confusion is very common. Compression stockings can be very helpful for some people with vein-related swelling. They apply gentle pressure that helps reduce pooling in the lower legs. But compression is not one size fits all. Some stockings are mild, some are strong, some are prescribed for daytime use. Some are not appropriate for certain circulation problems, and many older adults buy the wrong size. A stocking that rolls down behind the knee can create a tight band. A stocking that is too strong can be hard to put on and may cause skin injury. A stocking used over fragile skin or poor arterial circulation may be unsafe. So here is the Dr. Bennett version. Do not guess your way into strong compression. Ask your doctor, nurse, or pharmacist what level is right for you. For many people, compression is worn during the day when gravity is pulling fluid down into the legs. It is often removed at night, but your personal situation matters. If your clinician has told you to wear it differently, follow that plan. At bedtime, the most important thing is to remove any sock or band that is cutting into the skin. Inspect the skin, moisturize if appropriate, and keep the legs comfortably positioned. That is safer than sleeping in tight garments because an online video told you to. Now, bedtime fix number 6 is about dinner and fluids. This is one of the least dramatic steps, but it can make a very real difference. Many people think swelling is only about how much water they drink. But fluid balance is more complicated than that. Salt matters, protein matters, kidney function matters, heart function matters, medications matter, and timing matters. A very salty dinner can make some people wake up puffier. Common examples are canned soup, deli meats, frozen dinners, salty crackers, instant noodles, pizza, pickles, sauces, and restaurant meals. These foods are not bad in a moral sense, but they can be very high in sodium. And sodium can encourage the body to hold on to water. For a senior who already has slow venous return, that extra fluid may show up in the ankles. So tonight, look at your evening meal. Was it salty? Was it mostly packaged? Did it include enough protein? Low protein intake can also contribute to fluid problems in some people, especially if nutrition has been poor. A simple senior-friendly dinner might be baked fish or chicken, lentils, eggs, tofu, or Greek yogurt with vegetables and a modest portion of a starch such as potato, rice, or whole grain toast. And if your doctor has told you to follow a kidney diet, heart diet, diabetic diet, or fluid restriction, follow that advice. Now, about drinking water. I do not like telling seniors to stop drinking water for long periods without context. Dehydration can cause dizziness, constipation, confusion, urinary problems, and falls. But chugging a large glass of fluid right before bed may worsen nighttime urination and may not help swelling. So use a balanced approach. Drink steadily earlier in the day. Do not save most of your fluids for late evening. In the last 2 to 3 hours before bed, take small sips rather than large glasses, unless your doctor has given different instructions. This is especially important for people who wake up several times to urinate. The goal is not dehydration. The goal is better timing. Now we come to bedtime fix number 7. This is the one I most want seniors to understand because it can change how you talk with your doctor. The real long-term fix is not a secret supplement. It is finding the reason your legs are swelling. That may not sound as exciting as a miracle remedy, but it is the step that protects you. Let me explain. Swelling in both ankles that appears after a long day can be related to vein valves becoming weaker with age. That is called chronic venous insufficiency. In that case, the plan may include walking, calf exercises, leg elevation, skin care, and properly fitted compression. But swelling can also come from heart failure, kidney disease, liver disease, low protein levels, thyroid disease, arthritis inflammation, lymphedema, infection, injury, or medications. Very common medications can contribute to ankle swelling in some people, including certain blood pressure medications, anti-inflammatory pain relievers, steroids, hormones, and some diabetes medicines. This does not mean you should stop your medicine. Never stop a prescribed medication suddenly because of swelling unless your doctor tells you to. But it does mean you should ask. Here is the sentence I want you to use at your next appointment. Doctor, my ankles are swelling by evening and my socks leave deep marks. Could we review my heart, kidneys, veins, medications, and whether compression is appropriate for me? That one sentence is powerful. It helps your clinician think broadly. It also shows that you are not just asking for a quick fix. You are asking for the cause. Now, many viewers will ask about supplements. You may have heard of horse chestnut seed extract or pine bark extract for vein health. Some research suggests horse chestnut seed extract may help symptoms of chronic venous insufficiency for some people in the short term, but it is not safe for everyone. Raw horse chestnut is toxic. Supplements can interact with blood thinners and other medications, and people with kidney disease, liver disease, bleeding problems, upcoming surgery, pregnancy, or complex medical conditions should not start it casually. So my advice is simple. Do not take a new vein supplement tonight because a video sounded convincing. Write it down, bring it to your pharmacist or doctor, ask whether it is safe for you. That is what responsible senior health looks like. Now let's put the 7 steps together into a bedtime routine you can actually remember. First, inspect both legs. Look for one-sided swelling, redness, heat, wounds, or sudden changes. Second, turn on the calf pump. 10 heel raises, 10 toe lifts, slow ankle circles. Third, elevate with movement. Legs supported above heart level if comfortable, plus gentle ankle flexing for 5 to 10 minutes. Fourth, use warmth and upward massage. Comfortably warm water, careful drying, moisturizer, and gentle strokes toward the heart. Fifth, keep the pathway open. No crossed legs, no tight sock bands, no feet dangling, and use a pillow between the knees if you sleep on your side. Sixth, adjust evening salt and fluid timing. Avoid a very salty late meal. Drink earlier in the day and take small sips near bedtime instead of large glasses. Seventh, seek the cause. Bring persistent swelling to your clinician and review veins, heart, kidneys, medications, and compression options. That is the routine. Not dramatic, not dangerous, not a miracle, but practical. And for many seniors, practical is exactly what works. Before we finish, I want you to remember 3 warning signs. One leg suddenly more swollen than the other, swelling with chest pain or shortness of breath, swelling with redness, warmth, fever, or severe pain. Those are not bedtime routine situations. Those are medical situations. But if your swelling is mild, familiar on both sides, and worse after sitting or standing, tonight's routine may help you feel more comfortable while you arrange proper follow-up. Your feet carry you through your life. They deserve more than being hidden inside tight socks and ignored until they hurt. Take 2 minutes to look. Take 2 minutes to move. Take 10 minutes to elevate and breathe. And take the next appointment to ask the right question. Because the goal is not just smaller ankles by morning. The goal is safer circulation, healthier skin, steadier walking, and more confidence every time you stand up. I'm Dr. Claire Bennett, and I'll see you in the next video, where we'll talk about the everyday dinner habits that may quietly make evening swelling worse.